in the United States, good evening in India, and namaste to everyone around the world. My name is Sagar, and we welcome you to this discussion on yoga and management of addiction, hosted by the American Academy of Yoga and Meditation. At this moment, I would like to give a quick intro to our new viewers about what the American Academy of Yoga and Meditation is. AAYM, as it is also known, is a nonprofit organization for physicians, researchers, medical professionals, and practitioners of yoga and meditation, dedicated to education and research by fostering an interdisciplinary approach by linking science, arts, ethics, and spiritualism to improve human life. We all know that many people are addicted to many things, including food, technology, drugs, and alcohol. About 600,000 people die every single year from drug overdose. How can we control this addiction? How can we manage it? This is what we will be learning more about in today's discussion. Today, we will hear from some very well known speakers. Our first speaker, Dr. Indranil Basue, is a staff cardiologist and cardiac electrophysiologist. He is also the founder and chairman of AAYM, the organization presenting this yoga conference. Our second speaker, Dr. Sampath Shivangi, is the founding father of American Association of Physicians of Indian origin. He is also the national president for Indian American Forum for Political Education. Our third speaker, Mr. Debesh Malik, is the co-founder of Mind Over Matter Physiological Services. He is also a PhD student of clinical psychology. And now, I would like to introduce our moderator, Dr. Hemant Bhargav, who is an assistant professor in the Department of Integrative Medicine at the National Institute of Mental Health and Neurosciences. He has completed his professional degree in modern medicine from Indira Gandhi Government Medical College. He has different degrees, including a PhD in yoga from Swami Vivekananda Anushan Samsana, also known as S. Vyasa. He has an MBBS in modern medicine, an MD in yoga and rehabilitation, and a diploma in community mental health. It is a pleasure to have you all with us today. Once again, I would like to welcome all of our viewers around the world and to this wonderful discussion. And I will now pass it on to Dr. Hemant Bhargav to lead this discussion. Namaste.
Thank you very much, Mr. Sagar. I welcome the audience to this very interesting webinar, which is going to focus on the role that yoga and meditation, the yogic lifestyle can play in the management of addiction disorders. We have very well-known experts in the field today, and I hope the discussions will be very interesting. So first, let me introduce our first speaker, Mr. Debesh Malik. Debesh Malik ji has a master level clinical degree. He is also a PhD student of psychology from Pacific University, Oregon. Debesh ji's focus area of research is in integration of mindfulness, yoga, behaviorism, and spirituality, especially focusing the utility of these kind of interventions in substance use disorders. He himself has been a long-term practitioner of Kriya Yoga by the Self-Realization Fellowship. During his work on the mindfulness and these kind of interventions in addictive disorders, Dr. Debesh Malik actually worked in Dr. Sarah Boben's lab, and he was involved in Mind Over Matter Psychological Services. So I welcome Debesh ji to this forum.
Namaskar. Thank you, everybody. It's really an honor to be here and to be able to talk about just these topics that really inspire me and get me fired up. I think that to begin, I often think about this definition of what addiction is, and that was by the American Society of Addiction Medicine in 2011. They talked about addiction being a chronic, relapsing brain disease of reward, motivation, and related circuitry. And they said dysfunctions in these circuits leads to characteristic biological, social, and spiritual manifestations. So even, in 2011, in the definition of what addiction is, they touched on these spiritual manifestations. And I think that's important to begin with that, to understand uh, how to treat addiction. And so their new definition doesn't include that, but their older one does. And so if we really think about substance use disorder or addiction, we can think about it from the lens of really the human condition with the volume turned all the way up, right? If we think about things like craving, we think about the things that the different kind of yogic scriptures, the Hindu scriptures, the Buddhist scriptures have talked about. It's this attachment to craving. It's attachment and aversion, attachment to the sense pleasures, right? Which I think is very typified, very well represented in addiction, is this senses of attachment, this Maya, this delusion. Many different religions have talked about this in many different ways. The Judeo-Christian religions will talk about this as idol worship. In which these constructs and words get really confused and what their meanings are over time. But I think ultimately we're all talking about the same thing, more or less. So I get to be a part of a really awesome lab. My mentor was the first to look at, to really establish a program with her mentor, Alan Marlatt, on Vipassana practices for substance use disorder in the late, let me see, my 2000s, early 2000s. They brought in Vipassana practices to different prisons in America, and they found these practices extremely helpful for addiction. And from there, they were able to make a program, mindfulness-based relapse prevention, which has helped many people really deal with cravings, really deal with how to emotionally process negative emotions. If we think about some of the neurobiology, we know that addiction centers in the midbrain, ventral tegmental area, nucleus accumbens. It is a very kind of primitive, right? This was our hindbrain that we have developed more advanced thinking and executive decision-making skills in our prefrontal cortex. But addiction plays the central role in the midbrain. It is a disorder of the midbrain, so to speak. So when we have interventions that can help us pause, that deep breath, and focus on our prefrontal cortex, our more executive decision making, we're able to really align our decision making with our deepest values. Most people when they're young don't think about, I want to grow up and be a heroin addict. They don't think about, I want to grow up and be terribly addicted to food. It is not in line with our deepest values. The yogic practices help us connect and embody these deeper values. And there's an abundance of literature coming out. I got to write a book chapter coming out soon that kind of overviews yoga, transcendental meditation, mindfulness, and qigong, the kind of Chinese mindfulness practices, and how they've all been at least somewhat efficacious in the treatment of substance use disorder. But I want to come back to, I think this is such an important topic because for those of us in the healthcare field, I'm sure we have heard of motivational interviewing. And motivational interviewing was originally it was created for people with addiction. But it is now so widespread. It is used for almost anything, diabetes, chronic pain. And I think that what that says to me is that normally the symptoms of addiction manifest through all sorts of different disorders, craving, what it is to be human, attachment and aversion. And when we're able to turn our senses inwards and focus on what's actually happening, um, then there's this, I think the Bhagavad Gita calls it achapalam, this absence of restlessness or absence of fickleness, not reaching outwards to fix something that is internal. And we're able to sit with these discursive thoughts, these discursive emotions, in a way that that is more adaptive. In many ways, it's what we kind of really wanted the whole time. Um, I think that the 12-step programs address this pretty well. They talk about in great detail that this is a spiritual, what they call it is a spiritual malady. It says that that there is this feeling of unease. Buddhists call this dukkha, that this constant state of unease. If this was just a little bit different, then I'd be okay. If my painting was just shifted a little bit, then I'd be okay. If this person just acted a little bit differently, then I'd be okay. But that's the false idea. That's the Maya. That's the delusion presenting itself. But really, I'm okay anyway. You know, and what yoga and meditation show me is that this thought comes and this thought goes, right? And that thought could be a craving for substances. That thought could be a craving for food. That thought could be a craving to change somebody else's behavior. And that's one of the practices that we teach in mindfulness-based relapse prevention is the urge surfing technique. And we learn to kind of surf our breath as a wave that rides this feeling of craving up and down. We oftentimes people with addiction will think that when they're not using and they're trying to stop, that their craving will intensify and intensify and intensify, and it will only go down if they use drugs. But really, if you sit with it, if you focus on breath, if you're able to, you know, if you choose a more Hindu approach, focus on third eye, then it kind of goes away on its own. And I had the pleasure of being able to publish a study. I'm looking at a very simple practice of focusing on third eye and a breathing technique, kind of informed by Self-Realization Fellowship and what their meditations are for the public consumption. And, you know, and the group that did the meditation practice, just 20 minutes a day, about 3-4 days a week, they were less likely to relapse than the other folks who did muscle relaxation or the treatment as usual. And this is very preliminary, right? But you know what we have right now is a lot of data on mindfulness. The practice is informed from Vipassana, and what I would like to see moving forward is more packages of yoga and how we can integrate that into a medical context, you know, both in India and in the Western parts, that you know, and the swamis, the gurus have talked about this for years, that it is the marrying of Western society and the wisdom of the Eastern traditions together that will move us forward. And I believe
I
that's
think,
true.
Deveshji, I think you have brought out a very, very important point. Uh, the integration of the best of the East and the best of the West, which gurus have been trying. And one such person is with us who has been involved with the policy making in America. He's also connected with the policymakers in India. So I would like to welcome and take this opportunity to welcome our second speaker, Dr. Indranil Basu Ray. Please welcome, sir. Dr. Basu Ray is a cardiologist, cardiac electrophysiologist, and the director of cardiovascular research at the Memphis Veterans Medical Center in Memphis. He himself has learned Kriya Yoga from multiple Himalayan gurus. He also is a trained Vipassana practitioner. He is, of course, the founder chairman of the American Academy for Yoga and Meditation, the organization which has organized this whole chain of events, which we are all enjoying. Now, we see that Dr. Indranil Basu will be able to throw some light on the aspects of how to integrate the best of the East and the best of the West, and then bring something into the policy so that these mind-body interventions could integrate with the mainstream. Sir, your comments. Kindly unmute yourself, sir.
Namaskar. Thank you very much, Dr. Bhargav, for having me. Um, uh, it's important to understand that the role that yoga plays or policy that we make should be based on absolute science, because science of and the neurobiology of addiction has gone to a massive extent. Now we know the circuits in the brain that is involved, the points of differences between different types of addiction, the neurobiology of that, the mechanics, the genetical changes, the neuronal circuit changes. So it's very important to understand that, as Dr. Malik was saying, that it's a disease of craving. And disease of craving means that when you're starting to crave is a basic animal instinct. Every animal has it. Starting when there was dinosaurs had it, we have it, alligator has it, everybody has it. That's why it is in that part of the brain which we all share. We share a small part of the brain, that's the basic brain, having amygdala, hypothalamus, deep inside the midbrain, and every animal has it. But the difference between us and the other animal is, though we have this reward, which makes us eat, makes us sleep, makes us do things which gives us pleasure, we also have something called the frontal cortex, most of which has been developed in the last few million years, and almost exclusively it belongs to mammals. Most of the lower animals don't have it. And amongst the mammals, we humans have the most developed cortex. So this is sort of a superfine hierarchy, which is much higher than the midbrain and tries to make a balance between what the midbrain wants and what it should be getting. So what happens, unfortunately, is in people who have addiction, the addicting drug actually subverts the whole system, takes over, changes the brain's neuronal circuit, so much so that not only the neurons are changed, but also genetic expression of themselves are changed. How they communicate with each other through chemicals, even that is changed. And that leads to this, for a user to become an abuser, and from an abuser to become an addict. So this is a long cumulative process with changes happening at multiple levels. So, if we talk about the policy, I think it's first and foremost important. As we know, we have the largest opioid epidemic going on in the US, and almost 10 to 15% of the population all around the world have some form of addiction. Plus, fifth or sixth largest cause of is some form of addiction or rehab programs. So it's a huge financial economic problem. So policy wise, I think there are a couple of things that is very important to understand. Number one is, first and foremost, when we understand while the neurobiology of addiction is taught to some extent in the medical school, it's not taught very well, which is sad because almost 10 to 15% of even physicians are addicted. And a lot of physicians have suicide and other problems because of this. But unfortunately, in the medical school, this is not appropriately taught or given appropriate importance at all. Despite the fact that psychiatry or psychosocial medicine is taught to some extent, but this aspect is completely out of the medical curriculum in the right aspect. So that is one thing that needs to be incorporated at every level. Whether it's in India, whether it's in US, we need to incorporate this in medical school because this is a problem. This is a disease that is preventable completely. There are a lot of diseases that may not be preventable. So there's very little you can do. You can try to change the environment. You can do this, you can do that, but you still cannot change those diseases from happening. But fortunately for this is preventable. The other factor that is very important also to understand is a lot of the mechanism of addiction is very typical of the mechanism of regular life. For example, when you have increased stress, for example, family problem, economic downturns, all these can lead to addiction. And there are ways by which yoga can help in these things, exactly as it has been shown, starting from making epigenetic changes, genetic changes. So it's important to understand that medical school should understand not only the neurobiology of addiction, but also the neurobiology of what yoga can do and can bring out mental changes. That is number one. The second important factor that is very important to understand is most the practice of giving pain medications. So that is one important thing I have found all over India. I've been lucky to practice in some of the top hospitals in India, in government hospitals in India, and obviously here in America in multiple places. And I had a short stint in Canada too. Pain is a big problem because people have pain and there's no reason for them to suffer pain. But it's also important to understand for doctors that they must understand the treatment of pain in an appropriate methods. And if they cannot understand it, they should relegate it to physicians who are specialists in treating pain. Because what has happened is a lot of people who get to be addict initially did not start being an addict. Maybe they have got a spinal cord problem. Maybe they have got a broken knee. So they have been given opioids. So they started on opioid. They were normal users, but then they started becoming an addict after years of use. So it's important for physicians to understand while people, their patients should not be suffering pain, but it is clearly important to delineate who needs what. And if you're not appropriately trained in pain medicine, then my personal opinion would be that you should not be prescribing pain medications. It should be prescribed by people who are trained in doing that. There are a lot of psychiatrists who have taken pain medication, who are trained in pain medicine. There are a lot of anesthetists who are trained in pain medicine. There are a lot of internal medicine people who are trained in pain medicine, and it should be their job to treat. If you are interested in treating, that's absolutely fine. As a physician, you have the right to do that. But for that, you need to get appropriately trained. So that is another important. In America, you still have doctors who are trained in this. But in countries like India, there are very few people who are actually formally trained in pain medicine. Believe me or not, pain medicine is a learning curve of its own. You need to have dedicated fellowship to train people in pain medicine. Pain medicine, any doctor can give you a bunch of painkillers. That doesn't make you a pain medicine expert. You have to learn the pain pathways. You have to learn a lot of other things. And it's also important to understand that other than pain medicines, there are 90 other different ways to treat pain, like biofeedback, like yoga, like Vipassana, as Mr. Malik was saying. There are tons of other methods to treat pain or bring down the threshold of pain. There are also mechanical treatment, like giving electromechanical treatment, like giving stimulation to the spinal cord. There's a bunch of other mechanisms. There are ways to treat pain without using pain medications, but using anti-inflammatory medications, which are less habit-forming to almost not habit-forming. So it is important to understand the second important thing is we have to have pain. If we have to prevent opioid epidemics, we have to prevent alcohol epidemics in the future, we have to have people who are actually trained in pain medicine. Third, not the least, but very important, is having rehab centers where people can be treated in a formal way. In the US, the good news is that you do have rehab centers, and there are formally trained physicians, formally trained clinical psychologists like Debesh, who has been treating actual addicts with years of addiction with yoga, meditation. So you should have a formal training on those. It's theoretical knowledge is one, and practical training is other. And that's very important compared to the size of the country, which India is, over 130 crore population. It is important to have more rehab centers. Now, in America, we have a large number of rehab centers, but there has not been incorporation of integrative medicine into this practice as I'd like it to be. What does that mean? Most of the rehab centers still practice the age-old rehab problems. But in the last 20 years, we now know there is a large number of integrative techniques which can actually help and can have lasting measures. If I treat opioid with a less powerful opioid like buprenorphine, but if I add yoga to it, in the next 5 or 10 years, I can make sure that possibly that relapse will not take place at all. Because as you guys know, the relapse in most of the addiction treatment is extremely high. And brain mechanism is responsible for that, because addiction, unfortunately, as I said before, causes complete change of the brain in an adverse way. There is change in how the brain behaves. There is change in how the brain takes cues from environment to potentiate addiction. There is change how the brain. I'll give you one small example, example. In one animal study, electrode was placed in those areas of the brain that causes addiction, the reward center, and those rodents or the rats were asked to press on a paddle. Whenever they pressed on the paddle, they got stimulation in the reward center. So these rats were so excited in doing that they forgot all the other cravings like food, sex, to the point that they starved to death, but they went on pressing the paddle. Similarly, in human beings, when they did microdialysis of the brain, they found that the high multiple magnitude high amount of dopamine was stimulating the reward centers in patients who have craving for whatever it is, whether it's for cigarette, whether it's for opioid. So you have to understand that in this disease we are treating with a brain that has been completely changed in terms of its chemistry, in terms of its biology, in terms of its environmental cue or outlook, because there's multiple neurotransmitter changes, serotonin, glutamic acid, GABA, name it, everything is changed. And the neuronal circuitry also is completely changed. So it is very important to bring out that science and get people appropriately trained on it. Only then the policy can change. Otherwise you can have, okay, you can have official policy that all wine shops are going to be closed on a Saturday, Sunday, and or after 8 o'clock at night, but that doesn't make any difference to the common public until the public is educated about the problem, and we make policies not only for education of the common public but also the physicians, the other people who treat this disorder.
Indranil sir, I think you brought out a very important point. The opioid use and the prevalence of chronic pain. In fact, researchers have demonstrated that the prevalence of chronic pain has been on a gradual rise as compared to the last decade. In the current decade, the global prevalence of chronic pain has gone up from an average of 13% to 33%. In fact, in this COVID times, there has been an epidemic of opioid use, and it is a burning issue, not only in the US but in over the globe. In India, especially, the problem is grave because there is no proper regulation of these drugs, and there is over-the-counter kind of a prescription people can take and use them. We at Nimhans also get a lot of patients who suffer from this abuse of non-prescription opioid. And as you correctly said, most of them start using these opioids because they have been suffering from chronic pain, and they start with self-medication and then get addicted to it. So I would like to ask Mr. Malik about his experience of dealing with patients with opioid use disorders, and what kind of techniques would you suggest if people have chronic pain?
Yeah, thank you. This is such a. I think it's a topic that the APA, that the AMA, that they're struggling with, right? Because it is quite difficult. That when you have chronic pain and an addiction that manifested from chronic pain, that has sometimes gotten worse with prescription painkillers, it leaves you in a really tough spot. I've seen yoga techniques work for many people, though, with chronic pain. I've seen a TENS unit, biofeedback, different things that Dr. Basare talked about. There was a recent study that came out of the VA maybe 2 years ago where they compared I believe it was Oxycontin to ibuprofen, and they found no differences in how people responded to pain. That in some cases the Advil or ibuprofen worked better. So, and this was a study done with hundreds of patients. So, I mean, in many respects, it's like a lot of these pain medications are highly addictive. They were first marketed as not being addictive, but they are terrifyingly addictive. And when you're out of that supply, and you go to the streets for for illicit substances. Um, so I have found that to work. I have found, like Basuri talked about, buprenorphine, Suboxone treatment to work pretty well because it is, unlike methadone, it is a partial agonist and a partial antagonist. So it binds to the mu opioid receptor, and so the feelings of cravings go away. Um, and it has the naloxone, which blocks any additional opioids put into your body. So this dual action can be quite helpful. And for some people, they need it longer. For many folks, it may be a short-term thing where you pair that with the behavioral intervention. You pair that with the meditation-based intervention, mindfulness, acceptance and commitment therapy is a really, really good intervention informed by the Eastern traditions, where you're able to process and deal with the frustration, the emotional problems that come along with chronic pain, your relationships, the negative self-talk that goes on sometimes incessantly, and you can come out of that much better off. So I've seen folks do well with that. I've also seen folks that they just may need it while they're in treatment for 28 days, and then they taper off of the medication, and they do pretty well. But it is devastating. Fentanyl and carfentanil, the synthetic fentanyl analog, is terrifying. And I don't think it's going anywhere. Like a lot of people who sell these drugs are profiting millions of dollars from fentanyl. If they were to sell heroin, it would be a few $80,000-$90,000. So in a capitalistic society, this isn't going to go anywhere. So, we need to make better treatments for it. I talked to a doctor at Oregon Health and Science University, and he found that the fentanyl is causing wooden chest syndrome. And he put a camera in the larynx, and they found that it just shrinks after about 60 seconds of ingesting it. And you have the wooden chest syndrome, it falls, you die instantly, the overdose is much different than a heroin overdose, but it's pretty terrifying. But we have medications that work, we have behavioral interventions that work, so we need more of it. And as Dr. Basu talked about, the medical training, if you're lucky, most medical students get 1 hour of addictions training their entire career. That's not good. They need more. So
I think these are very valuable inputs. We are dealing with a very important issue. Dr. Ray, as Dr. Malik pointed out, that in opioid use disorders, the buprenorphine plus naloxone, these kind of treatments, they are effective. But one of the barriers or challenges in such kind of treatments is that to retain a patient with this treatment for a long duration has been a challenge. And then, do you think that these mind-body interventions integrated with such kind of treatment can enhance that retention? And then, what is your take on this?
Absolutely, there is no a on that. There's no any controversy on that. So let me step a little back to explain the biology, and then you'll
Yes,
understand why. While, as Debe said, things like buprenorphine are great drugs. They help you bring down the relapse. But if you really want people to bring down relapse even further, just putting
yes,
them on a drug is not enough. They have to take some sort of a behavioral mechanism. So, as I said, the problem is the midbrain has craving centers. Okay, the VTA. I don't want to take the technical names. Basically, it's deep inside your back of your head. That's where the midbrain is, and there you have a couple of neurons, couple of thousand neurons working there, and that acts to a place in the frontal cortex, which is something we developed as mammals, and humans have the best development of that cortex. That area, there is a between these two areas that causes craving and keeps craving, the reward center. So craving is very important, because of craving there is life on earth. I mean, you have to crave to eat. I mean, you have to crave for sex so that you reproduce. And this, I'm not talking only about human beings. I'm talking about starting from a bee to an alligator to you, me, every animal in this planet. So that's the basis of life on earth. The question is, how can we keep craving and rewards to the extent that it should remain and not being subverted by the drugs like opioids or alcohol? So what is happening is, when you start taking something, as Devesh said, like you have a pain in you have you're 55, 60 years old, you had an accident when you were a kid, or when you are 30, 40 years old, now you're 50 years old, your muscles have gone weak, so you have pain in your spinal cord, you can't walk. When you walk, you have pain. So obviously somebody gives you an opioid, you go to some local practitioner, he gives you an opioid for 10 days, and then you just get hooked to it because you feel good, you walk for a couple of days. Then you realize that you're taking one tablet a day. Now you need two tablets a day. And after 3 years, you need five tablets a day. After 10 years, you're on that 24/7 and you're out in the streets trying to get it illegally, paying 10 times the money. That's how those huge dollars that fentanyl costs, like less than 10 or 15 cents for us when I give it to my patients for my surgery. So if that can get you billions of dollars, you can imagine how much hike it is when it comes out to the street as an illegal drug. Because fentanyl has been there for 50 years, like 70 years now. It's not nothing new. It's nothing difficult to make. There are millions of manufacturers. But the problem is, these millions of manufacturers are all legal. So it's cheap. But when it goes to the streets, the price goes out 10,000 times. So this craving and reward happens because not only it starts with, first is you like it because your pain goes down. Then there are other systems in the hypothalamus which keeps memory of this, and it tries to flash those memories in your brain. Oh, I was good when I took that oxycontin, though you are fooled, because as Debe said, when you are taking a plain anti-inflammatory like ibuprofen, which is available in any shop in America, you don't have to go to a doctor, you just go and pick it up from the store. And I'll tell you why ibuprofen is even better than oxycontin in a little bit second, but let me explain you the craving part of it first. So but when my psychologically, I think oxycontin is better. So my hypothalamus, this is another core center which we share with all the reptiles on earth, that gives us cue. Oh, I was so good when I took that oxycontin. It's completely a created cue, because I psychologically, I think oxycontin is better than an anti-inflammatory like A. So what happens is that develops into it. Plus there are changes. For example, it releases certain chemical called which causes release of steroid inside the brain, inside the body. Then there are, I don't want to name them, there are things called the delta phospho B, which is released in the anterior cortex, and this sort of heightens this, heightens the neuron to crave and ask more for reward. And remember, and the funny part is that when you're having cocaine, you're actually having cocaine, you don't have much of anterior frontal cortex excited. The fact that you're going to have cocaine, if I put in electrodes in your brain is super excited because you're being flooded with fantastic memories. Oh, I'm going to live in heaven. So that's how the reward circuit works. And it propensates you to go into deeper and deeper addiction till you're completely dependent on it. You stop existing being an individual with logical thought process. Now, as you correctly said, this pandemic helps it. Why? Three things are very common with addiction, pandemic, and normal human being. What are those three things? Number one is stress. If you live on earth, you'll have stress. You might have a fight with your boss, you might have a fight with your wife or your husband, and that's normal. That's normal living. You might have, you may not get promotion as much as you need, or you might be in economic stress, and all of them are normal living in this world. Now the question is how you behave is what is important. So this is the same in case of addiction also. Addiction, there is stress because you're not, my body thinks that you can live in that heaven, and the only reason you're not reaching that heaven is because you're not getting the drug. So you're willing to do anything, kill people, murder people, go out into the street, pay whatever money you can, sell your whole house, but get the drug. So that's one thing. Second thing is inflammation. Possibly there is a lot of now that there is inflammation in the brain, and inflammation in the brain and body mirrors each other. These are some of the new findings in the last 10-15 years, mirror each other. Whenever you have things like depression, and pandemic causes depression because you may be locked out in your home because that's the only way to treat some of the dangerous pandemics. Number two, you may have lost your job. So all these cause depression, and depression itself causes inflammation both in the brain and in the vascular system, in the body, and that's why a lot of these addicts end up with a lot of heart disease and other problems. So the question is this, that the biomechanism of normal living and addiction is sort of an extreme. So addiction takes normal living to that extent that you become completely dependent on craving and reward without having a logical sense of the universe or the world around you. And yoga takes you to the other extreme. Yoga makes you understand the meaninglessness of this craving, that you become a slave to something that makes you lose your independence, that makes you lose your independent thinking, that makes you slave to a bunch of neurons which you are not. So that's where these two come together. Because so I have buprenorphine, as correctly Debe said, it's an antagonist agonist. So which means it acts on the receptors to propitiate craving. At the same time, when in enough doses, it will act as an antagonist and it blocks the real opioid to sit in those. And remember, we have opioid inside our brain. All the endorphins are basically opioid. That's how it was discovered. You don't have to take opioid from outside. So now the problem is this, that as long as I take buprenorphine, it's fine. But I want to have a complete prevention of relapse. So what I have to do is I have to change the neuronal circuits. Buprenorphine does change neuronal circuits, but it does not change it back to complete normal. That's where things like meditation, biofeedback, yoga comes around. For example, when you take deep breaths, your stress is reduced, your parasympathetic is activated, your stress inside the brain is reduced. CRP, which one of the chemical that I was talking about, corticotropin releasing factor, that is reduced. There's brain cell death, and there is abnormal neuroplasticity in addiction. That is converted back into a normal neuroplasticity where the cell death decreases because brain derived neural factors increased. That's how brain gets, you start creating new neurons which are helpful to you rather than being antagonist to you. Then the cerebral chemistry changes. Having predominant dopamine changes to predominant serotonin and other things which help. Secondly, you also have to understand that lot of this basically are a receptor problem, because so there are basically, to explain very simply, there are two types of neurons in the brain for a very common understanding. One type of neuron connects with another neuron, and most of them use things like glutamate, dopamine, things like this, amino acids, things like that. There's another neuron where a single neuron connects to multiple neurons. Most of them use things like GABA, glutamate, and all. Unfortunately, a lot of these addicting drugs, for example, amphetamine can act to some extent on the dopamine receptors because amphetamine is the same group. Cocaine acts on that too because cocaine activates the alpha-1, alpha-2 receptors in the presynaptic neurons. So when you make these changes permanent using yoga, it can surely happen that at the end you can stop your buprenorphine too and still not relapse back. So using drugs is good, as Debe said, not only good, should be used, because yoga doesn't happen. It's not like a switch on and switch off. Tomorrow you start doing yoga, day after tomorrow you're fine. You have to use drugs to prevent the initial treatment. And then you slowly bring in all the meditation, yoga, biofeedback, so that they get it more permanent, so that you can stop these rehab drugs also, and the patient can be completely changed, and you can get prevent longer relapse. Does that answer your question?
Yes, yes. Sir, I have come across 3 studies on opioid use where the yoga intervention has been given for 6 months, and then there was a reduction in the abstinence rate, even the withdrawal symptoms. So definitely, as you are saying, There is a question from the viewers also: does yoga work on substance addiction like meth? So definitely, the message is clear here, that in the beginning you have to take medications also, you have to adopt yogic lifestyle, meditative lifestyle also, and you have to be patient. You should not suddenly stop drug and the medications that you are taking, and expect that suddenly or in a few sessions there will be a change. So even the evidence is showing that 6 months are required to produce the changes which go up to your biological level, the neurobiological changes, the changes in the abstinence rate. And when we are talking about, as Dr. Ray said, that if you want to come out of the medications that you are taking, you should be even slower, and probably a year of a lifestyle may be required for you to completely prevent that relapse. And also, even after that, you should not take yoga like a medicine, that okay, I took it, I am okay now, and I am leaving it. So yoga should be something which should become a part of your lifestyle, it should become a part of your routine, and then only there will be the lasting impact. Contrary to medicines and the drugs that you take, the beauty of the sciences of yoga and meditation is that the more you do them, the more free you become. The lesser dose of yoga and meditation you require to go into that zone. So you want a high from outside, from some substances, but then there will come a time when you will start getting that natural high from within you. That is what Dr. Ray was talking about, that your own brain will release so much endorphin that the endogenous opioids will make you free from any kind of exogenous opioids. So that is the aim, and that is where we are moving, the inward journey of yoga and meditation, which even very beautifully Mr. Malik also pointed out the concepts of raga and dvesha, the attachment and aversion that is described in the yogic text. Oh, before we take this discussion further, I would like to request your permission, sirs, that we take some questions that are there in the chat box, and I would like to have your opinion on that. Okay. So first question is, I would like to direct it to Mr. Malik. Can we use breath retention techniques for alcohol addiction?
Yeah, well, I think the breath control and breath retention is a part of the package deals in a lot of the Vipassana studies. It normally starts with breath. If we look at things like polyvagal theory, they talk in depth about how specifically the vagus nerve stimulates this prefrontal cortex thinking and leads to better decision making. So in the recovery, in the field of recovery from substance use disorder, breath is absolutely a part of it. I believe it was Sharon Salzberg who said that your breath is portable. You know, it comes with you, right, everywhere. There have been so many addiction sciences. Okay, let me take out this relapse grid and let me write. But we're oftentimes not going to have to pull this grid out of our back pocket when we want to use drugs. But your breath is there, right? Always. And you can always go to breath. One of our techniques we use in mindfulness-based relapse prevention is called sober space. And it is when we're in automatic pilot. And the automatic pilot is we get shifted into the state where we make this quick decision, and it's a reaction. It's not a response. So it's stop, observe what's going on in the body, take that deep belly breath, expand your awareness back outward, and respond. And in those spaces, we're normally able to make better decisions. And it's not just with substance use, it's when we make a decision or engage in a behavior that we're not really too proud of. And in all of our research, we found that the technique that people use mostly long-term, 12-month, 18 months, is the sober space, which is more of an informal kind of mindfulness practice. But absolutely, breath retention, breath control is a huge part of all of this.
I think I completely agree with you, Mr. Malik, and I would like to reinforce your statement by actually a shloka that comes from an ancient yogic text called Hatha Yoga Pradipika. It says, "Chale vate chale chittam, nischale nischalam bhavit." It means as the breath moves, the thoughts in the mind moves. If the breath stops, the loop of thoughts. So craving also actually is a pattern of thoughts which is going in a very speeded pattern, and the thought is I want it, I can't live without it. These kind of thought patterns exaggerate the responses. And so therefore the breathing techniques, now the same text also prescribes to control these thoughts, to calm down these thoughts, two kind of techniques. One is breathing in, holding the breath, and then exhaling in the ratio 1 is to 4 is to 2. So this has been given in Hatha Yoga Pradipika and another text known as Tirumular Pranayama. So say you breathe in for 4 count, hold the breath for 16 count, and then breathe out for 8 counts, and maintain the same cycle and associate it with deep kind of a abdominal breathing. Patanjali's Yoga Sutra says Prachardhan Vidharana Bhyamva. It means you breathe in fully, exhale completely from your mouth, and hold the breath in external retention of the breath. So these are the kind of techniques which yoga texts have also talked about. And as Mr. Malik said, that modern scientific researchers also are exploring and they are finding them useful in controlling smoking. There are papers that the breathing techniques have helped smoking addiction, alcohol addiction. So yes, definitely. The second question is, what do you recommend for teenagers who are getting addicted to their mobile phones or social media apps like WhatsApp? Dr. Ray, would you like to comment on this? The digital addiction has become a big problem now. Gaming disorders. Kindly unmute, sir.
Yeah, absolutely. It is actually a very, very big problem because this has generated at least three big problems. First and foremost is it has caused an epidemic of obesity because these kids, instead of being in the football field or playing, jumping, dancing, they're like potato couch, sitting in their sofa set 24/7 and watching video or playing with their Nintendo or whatever. Number one. Number two
Very
is, and as
sad.
you see, out of the 41 states in America, almost bursting. And so in India, this has not been a problem for a long time. Now you are seeing exceeding number of obesity. And I have, me being a cardiologist, all the time I hear 32-year-old guy having 3 vessel bypass surgery. This was unknown in India even 15 years back, because nobody before 50 or 60 years had any, leave alone bypass, they didn't even need a stent. So this is all from the fact that physical activity is completely gone. So one is epidemic of obesity. Second is epidemic of cardiovascular disease. And as you know, in 2025, India will possibly have more heart attacks than the US, which is to different reasons. But one of the reasons is certainly this. And a third, which is very, very also important to understand, is this has given rise to a lot of eye problem and psychosocial problems. What is that? You have to understand that we are just like, though we call ourselves humans, we are basically animals. And an animal, just like a dog or a cat, learns how to behave by mixing with other dogs and cat. You and I learned how to behave not only from our parents, but by mixing with other people. Now, had you been sitting since you're 5 years of age to your 15 years of age only in your sofa set playing with video, the only person you know to interact is your Nintendo, who just does whatever you want to do. So these guys have started developing a new type of psychiatric problem where they cannot communicate enough or they cannot understand environmental cues. So there's a problem for them when they go for a job, when they go to interact with normal people, and some of them can get even violent because they think people are not responding the way they think, because obviously you can't expect a human being to respond the same way as a Nintendo. It's a totally different paradigm. So it's a big problem, and I think a couple of things can be done. Number one is parents should make it very clear that until the child is of an age where he really understands, he should not be given. I've seen people giving their small kids who are just 2 to 3 years of age iPad and let them play with it. So if you don't have time to play with your kids, arrange something else, but don't replace yourself with the iPad. That's a wrong parenting. That's an absolutely wrong parenting. And with modern day, what is happening is husband, wife both are working because economic downturn and other things is making everybody in the home work, which is fine. But that doesn't mean you replace yourself with an iPad, because what you're doing is you're basically killing the future of your child. And that needs to go to these people. And it's a shame, because a lot of these parents are highly educated and they still do this because they don't have the particular type of understanding at what how dangerous this whole thing can be. Number two, so they should be at least 7 or 10 years old when they understand the bad things before they should be handed over an electronic device. That is number one. Number two, we behavioral characteristic depends a lot on how your upbringing is. So upbringing is very important, what sort of environment you are. So home environment, make sure the home environment is amicable. You don't have every normal home has got some amount of discord here and there. That's normal part of life. But anything more than that triggers young kids to go for respite through this electronic media. Oh, my dad and mom is fighting all the time, so I'd rather have some peace sitting in a corner with a video. So that's very important. I mean, if you have a kid, you have some duty towards it as a parent also, and that's important to understand. It's difficult with this pandemic and other thing. It's easier for me to say, but difficult to do. But then you have to do it. I mean, there's no other option to it. Now, the other point that I wanted to bring about based on your last point is a little different from this. Is I get tons of questions. Oh, I do yoga from 4 to 5 p.m. And that's what I spend a large amount of time in America to make people understand that yoga is not Pilates. It is not trying to develop biceps so that you can become the next Arnold Schwarzenegger or the next Rambo. Yoga is a lifestyle. It is done 24/7, 365. It is not done. You don't go to a gym and do yoga. You can sit in your table eating food, still do yoga. You can talk with your wife or your husband or your father and mother, still do yoga. And there are a lot of yogis after 20, 30 years of practice, they can do practice yoga still while they are talking, they are eating, they are sleeping, or even when they're in the washrooms. So that takes time, but that practice has to be there, because one has to understand that you don't have to have severe stress, only then the bad things happen within you. Even mild stress causes bad things. Why? I'll tell you that. Human beings lived on this earth for 4 million years, or maybe 2 million years, God knows how long, but certainly most people agree it's at least 2 million. Some people say it's maybe even longer than that, but let's keep that to the specialist. But what is true, and there is no controversy on that, is we still behave like an animal. Why? Because out of this 2 million years, other than the last 5 to 10,000 years, we never lived in a house. We never got up in the morning to kiss our kids, or talk to our family, talk to our husband, wife, or talk to my father or mother. We got up in the morning and we might find an anaconda trying to get into our cave, or maybe a wildly hissing or a saber to the tiger just standing to get into my cave and eat me up. So there are three things we can do. One is we can stand in complete paralysis, so that think that we are dead and they leave you and go. Two, you fight it or kill it. And three, you just run away. So this fight or flight, this is the basic mechanism of a neuronal system even today, despite having whatever 5,000 or 10,000 years of civilization. So the fact that my neighbor has a better car than me causes jealousy in me. But what I fail to understand is the so-called jealousy causes the same inflammatory reaction in my brain that would have caused if I was being attacked by a saber-toothed tiger or a large anaconda. So most people don't understand this. Or the fact that Dr. Hemant Bhargav, and I think I'm more intelligent than Dr. Hemant Bhargav, but he has progressed more in life and I have not progressed that much, makes me crazy. The problem is we are not dinosaurs. If I was a dinosaur, I would have gone and eaten up Hemant Bhargav. And that human beings don't understand. But the problem is, because I can't eat him up, who am I damaging? Am I damaging Dr. Hemant Bhargav? Am I damaging Dr. Devesh Malik? No. Who am I damaging? I am damaging Dr. Indranil Basure every day. Subconsciously, I'm eating myself up. I am releasing chemicals with my brain which causes me to have stress. This stress causes my heart to go fast. The largest cause of death in America, every 2 seconds somebody dies, 2 minutes somebody dies, is called sudden cardiac death, because your heart goes suddenly fast and then you die out of it. Even before you can call 911 or a helicopter or an ambulance will come to your house, you're dead. This is because of this. So you have to understand that to prevent this, you have to have yoga 24/7, 365. You have to make it a habit. You have to live with it. It's not something you practice at a fixed time or a fixed date or a fixed interval. It is something that you practice throughout life. So that is important to understand. Now, a couple of other things that is important. I think somebody talked of breath, so I just wanted to point that out. That's a good point that Hemant brought up. So, what there is a practice in yoga called kumbhaka, where you basically hold breath. There are different types of kumbhaka. I don't want to go into that, but you can have kumbhaka with breath on, to be simple, without giving Sanskrit names, and you can have kumbhaka after exhalation also. And there are different yogic techniques to do that. It has been clearly found. There's a lot of research on that. Kumbhaka decreases sympathetic drive, increases parasympathetic drive. So, in any yogic practice, when you do practice kumbhaka, where kumbhaka means complete stoppage of breath. Basically, I'm sorry, I should have explained that. A lot of people may not understand what kumbhaka means. Kumbhaka means complete stoppage of breath. And in breath, kumbhaka means you take a deep breath or take some breath and then you hold breath. And exhalation kumbhaka means you completely exhale out and then hold your breath. And there are a couple of other take the couple of other mudras also that you can do with it. For example, you can do Jalandhar mudra. I don't want to go into all those yogic things, but there are techniques. But the core philosophy of those techniques is they almost all of them does three things. One is they decrease sympathetic drive. So all the bad guys, including cortisol, noradrenaline, all the bad guys are reduced substantially. All the good guys like vagal, parasympathetic are decreased. Third is mental brain, the brain functioning changes. So let me explain that a little bit more. So normal brain, as Swami Vivekananda said, is like a monkey dancing from one tree to other. Or another example that he very commonly used to give is like a clear pond. The water is so clean that you can see the floor of the pond. Now a kid is sitting by the side of the pond and going on throwing stones every second. So what will happen? You can't see the floor because there's water ripples everywhere. So if I do a normal EEG of our brain, you will find fast waves called beta waves. So brain is a paradoxical organ. When you have those beta waves, it looks like the brain is super active. Unfortunately, the brain is most inactive. Now, I am in this broadcast with you, Dr. Bhargav and Dr. Malik. So I have to see you to talk to you. So if I go to my visual cortex, area 18, 19, my eye is not seeing. My eye is just a receptor. It takes in the light and sends it to the brain. That's all it is doing. It has no power to see anything. It is just it's like a cup. You keep water in a cup, like you take light in a cup. So these are two big cups we have to pick up the light and just and dump it in the brain. It's the brain which is seeing. I can see Dr. Bhargav and Dr. Malik. But who is Dr. Bhargav, Dr. Malik? I don't know. So my brain is asking my area 41, 42 that who are these guys? Oh, I know Dr. Bhargav. He's a professor at NIMHAS. I know Dr. Malik. He's finishing his PhD. He has got a lot of clinical experience treating actual patients with addiction. So just like a computer, which if you don't have Microsoft Word, you cannot open a document. Same, my brain cannot open and understand what I'm doing until I have those cues. So if I put a small electrode in my area 18, 19 and my area 41, 42, I will not find the beta waves. I'll find very slow waves called delta waves. But if I am a monk who has practiced, or if I'm a householder, which I am, and I've practiced meditation for 30 years, if you put a micro electrode, you might not even find alpha. You might find delta wave or theta waves, super slow waves. And some people say gamma waves are the waves which might be responsible for even human consciousness. So when you do yoga, you control your entire brain. You not only there's an old saying, when you control your entire brain, you control the universe. So obviously, thought process is the process of the brain. If you can control your entire brain, you can control thought process. Craving is just one of the small things that is part of that. So as you practice yoga in your daily practice, you slowly come to a stage when you are no more the slave of your mind. And that is the crux of yoga. You are supposed to be the master of your mind. So whether it is craving for food, for sex, for drug, it doesn't matter. All cravings are bad. At the same time, you need craving because you have to to keep your physical body appropriately. So that balance has to be decided by the maintaining homeostasis. And that homeostasis is maintained by the brain appropriately until it is subverted by drugs or other addictive elements. To create back that homeostasis, you need to be in yoga 24/7, 365, and not say, oh, I have to do yoga from 4 to 5 p.m. every day after my office or after my job or before my going to bed. That doesn't work. Yeah, you can go to gym before your bed, but you cannot do yoga just going before your bed. You have to do yoga 24/7, 365.
Uh, Ray sir, this is a very, very vital aspect. You are talking about yoga as a lifestyle. Usually, we see most of the people, when we say the word yoga, they understand that, okay, they are doing certain kind of physical postures. But I also completely agree with you that yoga and meditation are not two different things. Yoga is an inherent, meditation is an inherent part of yoga. It is similar that there can be no physics without mathematics. In the same way, there cannot be a yoga without meditation into it. So the message is that whatever activities that you do, be completely mindful of that practice. Try to keep your mind in the present moment and have that yogic awareness in whatever activity that you do, and be aware of the yogic principles of lifestyle. That is the message that Dr. Ray is giving us. Now we are towards the last 5-6 minutes of the program, and I would like to take up few interesting questions. How can teenagers avoid peer pressure related to drug addiction? Dr. Malik, would you like to comment on this?
Yeah, well, I think that even in the question, it's the one of the main problems that I haven't talked about yet is avoidance. Um, Addiction stems from an avoidance of uncomfortable emotions, oftentimes, um, and normally we find that it's not necessarily of it's really avoidance ends up being quite problematic. So it's more so, and I think that it's big in Indian culture too, this stigma in addressing mental health concerns, right? And I think a lot of this stuff stems from if we look to the field of evolutionary psychology, um, that if, oh, I don't like this rock, I put it over there, and now the rock is no part of my life, I can go to my cave with peace. But we try to do that inwards in our minds, and it doesn't work. That we have to sit with and be with the uncomfortable emotions. So with peer pressure, I think it's like Dr. Basu Ray talked about. We create a space where our kids can talk to us about these things, where they can be open and talk about uncomfortable emotions, and really learn to build their own self-efficacy, self-esteem, self-efficacy, which self-efficacy is so strongly linked to addiction. The one study found that if you measure self-efficacy, it's almost the same as giving somebody a drug test. um, and so and so how to work on these esteem building things that I don't need. I um I don't my who I am is not dictated by what other people think of me, right? And when it is, in old psychology, we would call it an external locus of control. That who these people are, they define who I am. When I have an internal, intrinsic locus of control, it comes from the inside out. Um, it's a much different life. And to I guess end with my comment on that, it's been said that addiction is the only prison where the key to freedom is inside the cell, right? And a lot of it is that turning inwards, and as it's been talked about here, um, and and that these things are okay. It's okay to have peer pressure. It's okay to feel like you want to fit in. These things are very normal for kids, um, but kind of going deeper and being able to have that conversation with your primary caregivers, to be able to feel connected to them, to other friends, I think is crucially important and much more valuable and efficacious than just saying no. Just saying no doesn't work.
Okay. So thank you very much for the valuable inputs. Towards the end of the program, I would like to have concluding remarks and the message from the speakers for our audience, people who are suffering from different kinds of addiction or their caregivers. Ray, sir.
I think yoga is a powerful technique, should be used, and at every level, whether it's the level of physicians, they should learn the yoga techniques and use it not only for addiction, for every disease, because yoga can add a completely new dimension to existing. Modern medicine is what modern medicine is. It's good, but it doesn't cure 100% of the problems. So it's important to advance yoga for that reason. But especially for addiction, I think there are three levels of understanding which is very important. Number one is, as Dr. Malik appropriately said, it is the biggest problem with the person who develops this is singleness, loneliness, and lack of communication. So if you're a parent, it's your job to make sure that you're communicating with your kids, bad and good. There's one thing that Buddha said, and that's very, very important to understand. And he said that thousands of years back. If you're on earth, you will have these problems. That's normal. If you're born on earth, and all of us are born and live in this planet. So he said, having pain is mandatory, but suffering is optional. What does that mean? That's a very deep statement. So, I mean, if you have a life, you will have downturns. You cannot have a life only with upturns. If there's upturn, there has to. If there's a, there has to be a fall. So ups and downs are normal phases of life, and they have to be taken appropriately. So, and that means you should have an open communication. So kids should have open communication. Number two is, if you have a problem, go to a physician and talk to them. From the physician aspect also, if you're giving somebody pain medication, think twice. Should you prescribe? If you don't have the time to take care of his pain, you may be a neurologist, you don't have time, or you may be a I don't give, I hardly prescribe opioid at all. Not that my patients don't have pain. The reason is I'm not technically qualified to treat somebody's long-term pain, because I see them they come to me, I do a cardiac surgery and they're cured for life, they go away. So if I put them on an opioid, they'll remain on opioid the rest of their life. Who's going to be responsible for destroying their life? Me. So I, as a doctor, cannot do that. So I tell them, okay, if you have pain, I'll refer you to a pain specialist. So most of the other physicians should be doing the same. Refer them to the pain specialist. Let them decide what is appropriate, what is not appropriate, and they can appropriately do. Third is, at a policy level, we should introduce teaching of addiction, teaching of pain management all over the world. In every culture, pain is a problem. Pain is inherent as long as human beings are there. So whether it's America is having the opioid problem, India will have other problems. Every country might have different face of it, but it's a core problem that humanity faces. So you have to have specialized training at the medical school level for these people, and there's no exception to it. And last but not the least, I think public education is very important in these aspects. It's as important as anything else. Just like education for HIV, there was a time when people thought about HIV and they just ran away because there was lack of education. Same with addiction, as Debesh was saying. In India, people are just, oh, you're depression. That means you're crazy. No, 1 in 4 people in America has depression. They're not crazy. They perform as good as anybody wants. They are running huge companies. They're the CEO of world's topmost companies, because depression is a normal human reaction to a lot of things. And if you don't have depression, that means there's a big problem in you. If you really don't have depression, because depression is a normal reaction. But certainly, major depression and is not a normal. That could be a disease. And that's why you should keep your mind open, communicate, go to a physician who can treat, and stop having this as a mental illness. These are not mental illness. These are normal reactions to a normal living on earth. That should be clear to everybody.
Oh, that's it. Okay, I was looking at
Mr. Malik, your message.
Yes, I mean, everything Dr. Basure said, I completely agree with. I think
Yeah, let me call in about 5 minutes.
Our basic human nature is peace, right? This gets blotted out by other things. For many people with substance use disorder, it's they call it a spiritual disorder. I mean, when we look at wines, we call them spirits, right? The spirits are synthesized from the grains, or the barley, and it's kind of distilled, right? And how the word alcohol first came to be, it was Arabic al-kul. It means body eating spirit. So you have this synthetic spiritual experience that you feel connected to other people and yourself and maybe the infinite, right? But it's a pseudo spiritual experience. It's not real. It's Maya. It is the biggest definition of Maya, and it ends up boomeranging, and you have suffering, right? And now when we are in that state, it's actually sometimes nice, because then we can start to recreate our lives and learn these techniques of reflection, of yoga, of meditation, and connect to an authentic spiritual experience of connection. And the literature describes this in other words, but I think that's at the core of this: pro-social behaviors, being able to connect with other people. As we talked about, this is an isolating illness. And we evolved from, our forefathers were the ones who left their cave and had children and consorted with other people. And we evolved in tribes. We're tribal beings. And so a big part of we have a biological imperative to be in community, to be with other people. We recover together. And when we isolate different parts, or when we say this person's bad because they did this, and they feel that cut offness and separation, that's where addiction thrives, because you actually feel that. There was a talk recently done about there's a certain brain region. It's connected to heroin addiction. It's connected to feeling isolation and connection when it's functioning well. It is connecting. When it's functioning not so well, it's isolating. But opiates actually make you think that you're connected to other people. And so when you feel that, you're not going to have that endogenous drive to go out and be in community. So the first step is abstinence and being able to learn how to connect with other people, yourself. And what is the definition of yoga? Connection with the divine, connection with this transcendental spirit. And so I think these things are incredibly important. And I think ultimately it's what people with addiction really want, but they may be confused about that early on, because, as Dr. Basure said, it tricks and it rewires the brain, but we can rewire it back. We know neurogenesis works. We know these things, and so it is absolutely possible. Thank you so much.
What a wonderful message that has come out from both these speakers for the audience here. And in a nutshell, we can say that both these speakers agreed that craving is a natural response of the body. It is a natural response of the human mind, but when it goes out of control, then the problem happens. It is the more externalized kind of a movement of the consciousness which goes out of control. And both the speakers suggested that the path of yoga and meditation takes the journey inwards. It takes you inside, and then the longing connectedness that you crave outside, you get that fulfillment from within you, and this is which gives you freedom. But also both these speakers cautioned against taking any kind of drastic steps, depending completely on yoga and stopping the medication suddenly. No, the path of yoga and meditation is always about patience, perseverance, and practice. So yes, all the viewers, please adopt yogic lifestyle and take this journey towards complete freedom. Thank you once again for joining me, the speakers. I am really grateful to both of you. It was a wonderful learning experience for me, and I'm sure for the audience who witnessed this wonderful webinar. I also thank American Academy of Yoga and Meditation for giving this amazing platform and choosing this apt topic in the current scenario. Now I hand over the proceedings to back to Mr. Sagar.
Thank you so much, Dr. Bhargav. It was a great discussion. You all explained the different aspects of management of addiction so well. Once again, I would like to take this opportunity to tell you all thank you and how wonderful this discussion became because of you. I loved how Mr. Malik, you gave the location of where addiction occurs in our brain and how you talked about motivational interviewing and how that helps with management of addiction. You also said that you also explained the different breathing exercises and how they help brain circulation and as well as the different management of addiction. I also loved how Dr. Basire, you talked about this, how we all have the same type of brain, and you listed the different parts of our brain. I also like the way you explained how the meat brain changes due to which a user becomes an abuser and then an abuser becomes an addict. You also said that a person should first get treatment from allopathic medicine and then to reduce the risk of addiction to that medicine, we should do meditation and yoga. And lastly, Dr. Bhargav, you moderated the session so well. You tied in all of the points that Dr. Basure and Mr. Malik said. It was honestly a great webinar. Actually, our next webinar, Pain Management with Yoga, will be in about 10 minutes. So everyone, please join this upcoming informative webinar. And before we end here, I'd like to thank our tech team, Ritesh ji and Janet ji, for making this webinar so great. Once again, I would like to thank all of our viewers for joining us for this discussion, and I hope you all enjoyed this discussion today. Hope you all have a great rest of your day in the United States, and good night to those in India. Namaste.